Everybody deserves a good quality care in terms of the medicine. I really think that it's fair that if the patient knows the surgery but knows the treatment but doesn't get it, well, it's his own choice. It's a fair situation. But I think it's unfair if the patient wasn't able to get the surgery because he didn't know about the presence of the surgery.
Good morning, it's great to see you.
Good morning, good to see you again, Helen.
How are you today?
Great.
So, you've been very busy. I hear you recently visited Vietnam.
Mm-hmm.
Can you tell me a bit about that trip? What took you to Vietnam?
To train how to do the penile implant in Vietnam. So it was a very honorable moment for me because it was a great honor because it was first time in the Vietnam's history doing the inflatable penile prosthesis. So that's why I went there.
So a very monumentous trip, you could say.
yeah, it was.
Good. And how much experience do you have in this field?
Guess I've been in this field for past 7 years now. And I have done around a little more than 1,000 cases of the inflatable penile implants.
Mm-hmm.
That may not sound a lot of cases, but usually big implanter in the US, the criteria is 25 cases per year. If they do more than 25 cases per year, they can be named as a big implanter. But I usually have done about more than 200 cases a year. So actually outside the US, I may be doing the most cases yearly.
How was the Vietnamese hospital? How did you find the staff and surgeons there?
I arrived in Vietnam 11:10 p.m. and they were waiting for me right in front of the airplane exit. It was that late, but they were still working, waiting for me to greet me. So they were very passionate and enthusiastic people.
Yeah, they were so excited for your visit.
Yeah, it looked like that. So I never get a flower in the airport. It was my first time, and everybody was watching me. What the heck, that guy was getting a flower, something like that. So.
And what was the first thing you had to do when you came to the hospital?
First thing I had to do was to show the surgeons how to do the surgery, to give them a heads up with the procedures we are going to do, and show them the video of the surgery so that they can understand and expect what we'll go through.
And I understand there were 2 surgeries that day.
Yeah.
So the first one you performed. Can you tell me about how that went?
The first case, it is better to show them how to do it. And while doing so, you have to hands-on. Let their hands-on to the patients as well. So you do this side, as we have a left and right side, I do right side, they do left side,
So
and
they're
back and
also
forth.
taking
part in the surgery. So that's the first case, how the first case went.
Mm-hmm. And the second surgery then was performed by the Vietnamese surgeon?
Sure. So next case, it should be led by him. He was in the surgeon's position. I was in the assistant position, and I was trying to, ask him questions like, "Okay, Dr. Min, what's next?" So I was questioning him, "What's next? What's next?" Something like this, so that he can remember every single points and every single important steps. Mm-hmm. When there is not, I won't be there. I can't be there, right? I have to come here back. So he should be able to run his own. But I just want to give him a very important points to be remembered.
And as this was the very first penile implant case in Vietnam, we heard a lot of people came to watch the surgery. Was it just the staff in the hospital?
You had to see the site. When I was doing the first case, there was I wasn't able to see it, but guys who were sitting there, told me there was a TV broadcasting team there.
Wow.
And camera was on live, and the 30 other surgeons were around us, and 20 more outside the room was watching the surgery.
So can you tell me more about the broadcasting in Vietnam?
So it was like a national, broadcasting parties. Like in Korea, it's like KBS or MBC, but in your country, BBC?
BBC.
Maybe, something like that. After all the surgeries done, all the, official workshop was closed. And at the dinner, they told us that at the 6:30 in the Vietnam time, at that day, the event we had was on TV, on the main broadcasting, party. It was a huge, event. in the Vietnam it looks like. The hospital which held all this event was the People's 115 Hospital in Ho Chi Minh City. So it's a more than 2,000 beds hospital. 2,000 beds is almost as big as Asan Hospital or something like that. One of the biggest hospitals in South Korea. A huge hospital with a lot of attention there. So it was a very interesting experience and a very exciting experience for me because I never knew that I will be on the TV screen talking about the penile implant, but it happened there.
And there was not only training involved, I understand there was a presentation and a question and answer session.
I mean, they wanted to talk about everything about the penile implant, from the post-op, pre-op, operation and post-op, everything. So I had to take the general aspect of the penile implant. Wow, it was a long talk. They gave me 45 minutes, which was the longest talk I ever done.
And how do you feel your presentation was received?
I don't know, actually, because most people were using the translators. So someone was translating my talk in Vietnamese. I don't know how they translated, but they kept asking me questions after the talk. Maybe I was able to give them some curiosity as well.
So how do you make time for these trainings besides already running your own center?
I was trained by the Dr. Wilson in the US. He has been trained more than 3,000 surgeons around the world. He has been in this field for past 42 years. I call him Papa because he showed me how to live one's own life. At a certain point, we all understand that money is not everything. And I always wanted to be like Dr. Wilson. Papa has always been very enthusiastic of the training the new young surgeons. Let's say if I'm gone, if I die, my surgical skills will be lost as well. Someone should carry the torch for the next generation.
And would you like to do it again in the future? Do you
Sure.
hope to be a doctor? Yeah.
If they want me, I'll always go there. And my next trip is to the Saudi. So I haven't been to Arabian countries before. I not know any people actually coming from there. But still, there's a great excitement for me because I want to see and know their culture and their system and their circumstances as well.
How do you think that will be different to your trip to Vietnam?
Honestly, I don't know. I can only tell you after I go there. So, very happy. I'm very excited at the same time, becoming pressured as well, because I have to prepare very well so that I can help them when I go there.
Well, I wish you lots of luck in Saudi Arabia.
Thank
Thank
you.
you for coming to speak to us today.
Great moment, and I hope to see you again soon.